Hi, my name is Connie Fox. I am one of the nurses here at the Diabetes Center. Today I'm going to talk to you about sick day rules. Those of you who have diabetes understand and have probably lived it several times how difficult it is to control your diabetes during that time when you are ill. And that can mean major or minor surgeries, infections, or just a bad cold. Any of those can affect our blood sugars. So let's talk about what happens during that time. What happens during the time is the fact that our body views that as a stress. And as you are well aware of, when we're under stress, our blood sugars go up. So we always need to keep that in mind. Even though when you are ill, you may not feel like eating things that you normally do or eating at all. So here are the rules. Number 1, please always take your diabetes medicine, whether that's your oral medicines or your insulin. Try to eat. Now, I know that may be difficult, and especially during the times when you're vomiting or having diarrhea. It is during those times you may have to drink carbohydrates, which fluids that have sugar in them. For example, regular Jell-O, regular pop, broth, things like that. So it's during that time that you would drink your carbohydrates. If you're just feeling nauseated and just don't have the appetite that you normally do, try to eat the foods that might set well in your stomach. For example, crackers, cream of wheat, broth, things like that. And try to follow your meal plan. So how many carbohydrates you get at meals, try to follow that with foods that are going to set well in your stomach. Number 2, you're going to test your blood sugars more often. If you are on orals and you're checking once daily, maybe you need to check every 4 hours or twice a day to see if your blood sugars are remaining high. If you are on insulin, you may need to have to test as frequently as every 2 hours. If blood sugars are high and you are on insulin, you may need extra insulin during this time. With oral medications, we cannot always increase certain oral medications. So you may just have to deal with a higher than normal blood sugar during this time. You need to drink plenty of fluids. The styrofoam coffee cups that you have seen around either here at the hospital or in doctors' offices, those are 8 ounces. You need at least 8 ounces of water every hour while you're ill. We do not want you to become dehydrated. You need to treat aches, pains, fever with Tylenol products.